Nutrition NCLEX questions. Question 1. Which statement made by an adult patient demonstrates an understanding of healthy nutrition teaching? I need to stop eating red meat. I will increase the servings of fruit juice to 4 a day. I will make sure that I eat a balanced diet and exercise regularly. I will not eat so many dark green vegetables and eat more yellow vegetables. Question 2. The nurse teaches a patient who has had surgery to increase which nutrient to help with tissue repair? Fat, protein, vitamin, carbohydrate. Question 3. The nurse is caring for a patient experiencing dysphagia. Which interventions help decrease the risk of aspiration during feeding? Select all that apply. Sit the patient upright in a chair. Give liquids at the end of the meal. Place food on the strong side of the mouth. Provide thin foods to make it easier to swallow. Question 4. The nurse suspects that the patient receiving parenteral nutrition, PN, through a central venous catheter, CVC, has an air embolus. What action does the nurse need to take first? Raise the head of the bed to 90 degrees. Turn patient to left lateral decubitus position. Notify healthcare provider immediately. Have the patient perform the Valsalva maneuver. Question 5. The acceptable macronutrient distribution range for carbohydrates is 20 to 30% of Cal, 45 to 65% of Cal, 10 to 25% of Cal, 30 to 45% of Cal. Question 6. Which action is initially taken by the nurse to verify the correct position of a newly placed smallbore feeding tube? Placing an order for X-ray film examination to check the position. Confirming the distal mark on the feeding tube after taping. Testing the pH of the gastric contents and observing the color. Auscultating over the gastric area as air is injected into the tube. Placing an order for X-ray film examination to check position. Question 7. The catheter of the patient receiving parenteral nutrition, PN, becomes occluded. Place the steps for caring for the occluded catheter in the order in which the nurse would perform them. Attempt to aspirate a clot. Temporarily stop the infusion. Flush the line with saline or heparin. Use a thrombolytic agent if ordered or per protocol. Question 8. Which correctly defines the total fiber adequate intake? 25 g/day for women and 38 g/day for men. 10 g/day for women and 15 g/day for men. 30 g/day for women and 35 g/day for men. 28 g/day for women and 33 g/day for men. Question 9. A. Micrococcus, Helicobacter pylori. Staphylococcus C. Corynebacterium D. Helicobacter pylori. Question 10. AMDR, acceptable macronutrient distribution range, for fats is 20 to 30% of Cal, 45 to 65% of Cal, 20 to 35% of Cal. Question 11. AMDR, acceptable macronutrient distribution range, for protein is 10 to 35% of Cal, 15 to 25% of Cal, 35 to 45% of Cal. Question 12. The nurse is assessing a patient receiving enteral feedings via a small-bore nasogastric tube. Which assessment findings need a further intervention? Gastric pH of 4.0 during placement check. Weight gain of 1 pound over the course of a week. Active bowel sounds in the 4 abdominal quadrants. Gastric residual aspirate of 350 ml for the second consecutive time. Question 13. The home care nurse is seeing the following patients. Which patient is at greatest risk for experiencing inadequate nutrition? A 55-year-old obese man recently diagnosed with diabetes mellitus. A recently widowed 76-year-old woman recovering from a mild stroke. A 22-year-old mother with a 3-year-old toddler who had tonsillectomy surgery. A 46-year-old man recovering at home following coronary artery bypass surgery. Question 14. What are the water-soluble vitamins? C and B complex. Incorrect alternative 1. Incorrect alternative 2. Incorrect alternative 3. Question 15. Which statement made by a patient of a 2-month-old infant requires further education? I'll continue to use a formula for the baby until he is at least a year old. I'll make sure that I purchase iron-fortified formula. I'll start feeding the baby cereal at 4 months. I'm going to an alternate formula with whole milk starting next month. Question 16. What are the fat-soluble vitamins? D, E, K, A. Incorrect alternative 1. Incorrect alternative 2. Incorrect alternative 3. Question 17. The nurse is checking the feeding tube placement. Place the steps in the proper sequence. Draw 5 to 10 ml gastric aspirated into a syringe. Flush tube with 30 ml air. Mix aspirate in syringe and place in a medicine cup. Observe the color of gastric aspirate. Question 18. Which vitamin aids in iron absorption? Vitamin B, vitamin C, vitamin E, vitamin D. Question 19. The nurse is teaching a program on healthy nutrition at the Senior Community Center. Which points should be included in the program for older adults? Select all that apply. Avoid grapefruit and grapefruit juice, which impair drug absorption. Increase the amount of carbohydrates for energy. Take a multivitamin that includes vitamin D for bone health. Cheese and eggs are good sources of protein. Question 20. Vegan diets can lack which vitamin, due to not naturally occurring in plants? B12. Incorrect alternative 1. Incorrect alternative 2. Incorrect alternative 3. Question 21. The nurse sees the nursing assistive personnel, NAP, perform the following for a patient receiving continuous enteral feedings. What intervention does the nurse need to address immediately with the NAP? The NAP fastens the tube to the gown with tape, places the patient supine while giving a bath, performs oral care for the patient, elevates the head of the bed 45 degrees. Question 22. What are the major actions of vitamin C? Antioxidant, tissue building, absorption. Incorrect alternative 1. Incorrect alternative 2. Incorrect alternative 3. Question 23. The patient receiving total parenteral nutrition, TPN, asks the nurse why his blood glucose is being checked since he does not have diabetes. What is the best response by the nurse? TPN can cause hyperglycemia, and it is important to keep your blood glucose level in an acceptable range. The high concentration of dextrose in the TPN can give you diabetes, thus you need to be monitored closely. Monitoring your blood glucose level helps to determine the dose of insulin that you need to absorb the TPN. Checking your blood glucose level regularly helps to determine if the TPN is effective as a nutrition intervention. Question 24. Major sources of vitamin A: orange/yellow fruits and vegetables, fatty fish, dairy. Incorrect alternative 1. Incorrect alternative 2. Incorrect alternative 3. Question 25. The nurse is performing blood glucose monitoring for a patient receiving parenteral nutrition. Place the steps of the procedure in the correct sequence. Clean puncture site with an antiseptic solution. Identify patients using 2 identifiers. Check code on test strip vial. Wick blood drop into the test strip. Question 26. Major sources of vitamin D: sunlight, fish, fortified dairy products, egg yolk. Incorrect alternative 1. Incorrect alternative 2. Incorrect alternative 3. Question 27. Major sources of vitamin E: vegetable oils, grains, nuts, dark green vegetables. Incorrect alternative 1. Incorrect alternative 2. Incorrect alternative 3. Question 28. Vitamin C and B complex. Water-soluble vitamins. Trace elements. Basal metabolic rate. Amino acid. Question 29. Inorganic elements that act as catalysts in biochemical reactions. Water-soluble vitamins. Basal metabolic rate. Basal metabolic rate. amino acid. Question 30. Major sources of vitamin K, green leafy vegetables, eggs. Incorrect alternative 1. Incorrect alternative 2. Incorrect alternative 3. Question 31. The energy needed to maintain life-sustaining activities for a specific period of time at rest. Water-soluble vitamins, trace elements, basal metabolic rate, amino acid. Question 32. Underscore is used for synthesis of thyroxine, the thyroid hormone that helps regulate metabolism. Iron, sulfur, iodine, phosphorus. Question 33. Major sources of potassium: oranges, dried fruits, tomatoes, avocado, dried peas, meats, broccoli, bananas, dairy products, meats, whole grains. Incorrect alternative 1. Incorrect alternative 2. Incorrect alternative 3. Question 34. The simplest form of a protein. Water-soluble vitamins, trace elements, basal metabolic rate, amino acid. Question 35. Made up of 3 fatty acids attached to a glycerol. Triglycerides, nitrogen balance, polyunsaturated fatty acids, resting energy expenditure, Re. Question 36. What is the minimum daily amount of water intake needed? 1,500 ml. Incorrect alternative 1. Incorrect alternative 2. Incorrect alternative 3. Question 37. Under normal conditions, the AI for adult fluid intake is 2 L/day for men and 1.1 L/day for women, 3 L/day for men and 3.5 L/day for women, 3 L/day for men and 2.2 L/day for women, 2.2 L/day for men and 3 L/day for women. Question 38. Carbohydrate units: lipids, nutrient density, saccharides, dispensable amino acids. Question 39. A medication that decreases BMR is epinephrine, levothyroxine, amitriptyline. Question 40. When calculating percent weight change, greater than ___% in 1 week indicates significant weight loss. 2%, 4, 6. Question 41. When calculating a percent weight change, greater than ___% in 3 months indicates significant weight loss. 5.5, 6.5, 7.5%. Question 42. Overweight is defined as a BMI of ____to 25 to 29.9. Incorrect alternative 1. Incorrect alternative 2. Incorrect alternative 3. Question 43. Patient symptoms are projectile vomiting, fever, myalgia, watery diarrhea, and headache. Consumed contaminated fruits and vegetables, salads prepped by an infected person, oysters, and / or contaminated water. Foodborne illness is _____. The onset of 24 to 48 hours. Listeria, E. coli, norovirus, salmonella. Question 44. Mrs. Nelson is talking with the nurse about the dietary needs of her 23-month-old daughter, Laura. Which of the following responses by the nurse would be appropriate? Use skim milk to cut down on the fat in Laura's diet. Laura should be drinking at least 1 quart of milk per day. Laura needs less protein in her diet now because she isn't growing as fast. Laura needs fewer calories in relation to her body weight now than she did as an infant. Laura needs fewer calories in relation to her body weight now than she did as an infant. Question 45. All of the following patients are at risk for alteration in nutrition except Patient L, whose weight is 10% above his ideal body weight. Patient J, who is 86 years old, lives alone and has poorly fitting dentures. Patient M, a 17-year-old girl who weighs 90 pounds and frequently complains about her baby fat. Patient K, who has been allowed nothing by mouth, NPO, for 7 days after bowel surgery and is receiving 3,000 ml of 10% dextrose per day. Question 46. A patient who has been hospitalized after experiencing a heart attack will most likely receive a diet consisting of low fat, low sodium, and low carbohydrates. Low fat, low sodium, and high carbohydrates. Low fat, high protein, and high carbohydrates. Liquids for several days, progressing to a soft and then a regular diet. Question 47. Acceptable foods for the full liquid diet. Liquids from clear liquid diet, all forms of milk, soups, vegetable/fruit juices, eggnog, plain ice cream and sherbet, refined/strained cereal, puddings. Incorrect alternative 1. Incorrect alternative 2. Incorrect alternative 3. Question 48. Indications for full liquid diet. Transition from liquid to soft diets, post-op, acute gastritis, febrile conditions, intolerance of solid foods. Incorrect alternative 1. Incorrect alternative 2. Incorrect alternative 3. Question 49. Contraindications for full liquid diet. Lactose intolerance or hypercholesterolemia. Incorrect alternative 1. Incorrect alternative 2. Incorrect alternative 3. Question 50. The slenderized liquid, pureed, diet consists of liquids and foods that are pureed to liquid form. Incorrect alternative 1. Incorrect alternative 2. Incorrect alternative 3. Question 51. Indications of slenderized liquid, pureed, diet. Chewing/swallowing difficulty, oral/facial surgery, wired jaws. Incorrect alternative 1. Incorrect alternative 2. Incorrect alternative 3. Question 52. Soft, bland, low-fiber diet consists of whole foods that are low in fiber, lightly seasoned, and easily digested. Incorrect alternative 1. Incorrect alternative 2. Incorrect alternative 3. Question 53. Indications of soft, bland, low-fiber diet. Transitioning between full liquid and regular diets, acute infections, chewing difficulties, GI disorders. Incorrect alternative 1. Incorrect alternative 2. Incorrect alternative 3. Question 54. The mechanical soft diet consists of foods that require minimal chewing before swallowing, ground meats, canned fruits, softly cooked vegetables. Incorrect alternative 1. Incorrect alternative 2. Incorrect alternative 3. Question 55. Indications of mechanical soft diet. Limited chewing ability, dysphagia, poorly fitting dentures, clients who are edentulous, without teeth, surgery to head, neck, or mouth, strictures of the intestinal tract. Incorrect alternative 1. Incorrect alternative 2. Incorrect alternative 3. Question 56. What is the dysphagia diet used for? Prescribed when swallowing is impaired, such as following a stroke. Incorrect alternative 1. Incorrect alternative 2. Incorrect alternative 3. Question 57. Signs of dysphagia. Drooling, pocketing food, choking, gagging. Incorrect alternative 1. Incorrect alternative 2. Incorrect alternative 3. Question 58. What are the 3 levels of solid textures of food used in the dysphagia diet? Provide examples of each. Level 1. Pureed fruits, veg, meats, soups, scrambled eggs, pudding, custard, applesauce. Incorrect alternative 1. Incorrect alternative 2. Incorrect alternative 3. Level 2. Mechanically altered ground meat with gravy, chicken or tuna salad, moistened pancakes and syrup, poached eggs, soft canned or cooked fruit. Level 3. Advanced moist foods such as soups, rice, stuffing, tender meats or cassettes, breads that are not crusty. Question 59. What are the 4 levels or liquid consistencies in the dysphagia diet? Provide examples of each. 1. Thin, clear juices, freo, ice seam, milk, soda, broth. Incorrect alternative 1. Incorrect alternative 2. Incorrect alternative 3. 2. Necar-like, thicker than water but can sip through a straw. Consistency of heavy syrup. X. Nectars, cream soups, buttermilk and thin milkshakes. 3. Honey-like, pourable and thickened, can be eaten with a spoon but not sipped through a straw. X. Honey, tomato sauce, yogurt. 4. Spoon-thick, maintain shape and eaten with a spoon. X. Pudding, custard, hot cereals. Question 60. Indications for the regular diet, normal or house diet. For clients who do not need dietary restrictions. Incorrect alternative 1. Incorrect alternative 2. Incorrect alternative 3. Question 61. Examples of honey-like liquid consistencies. Honey, tomato sauce, yogurt. Incorrect alternative 1. Incorrect alternative 2. Incorrect alternative 3. Question 62. Examples of spoon-thick liquid consistencies. Pudding, custard, hot cereals. Incorrect alternative 1. Incorrect alternative 2. Incorrect alternative 3. Question 63. Examples of nectar-like liquid consistencies. Nectars, cream soups, buttermilk, thin milkshakes. Incorrect alternative 1. Incorrect alternative 2. Incorrect alternative 3. Question 64. This form of nutrition administration is used when a client cannot consume adequate nutrients and calories orally, but maintains a partially functional GI system. Enteral nutrition, N. Incorrect alternative 1. Incorrect alternative 2. Incorrect alternative 3. Question 65. 2 reasons enteral nutrition might be administered. Medical condition, burns, trauma, radiation therapy, demo, liver/renal dysfunction, infection, inflammatory bowel disease, or when a client is neuromuscular impaired and cannot chew or swallow food. Incorrect alternative 1. Incorrect alternative 2. Incorrect alternative 3. Question 66. What does enteral nutrition consist of? Commercial formula administered by a tube into the stomach or small intestine. Incorrect alternative 1. Incorrect alternative 2. Incorrect alternative 3. Question 67. What is gavage feeding for an infant used for? aka N feeding for an infant who is too weak for sucking, unable to swallow, and lacks a gag reflex. Incorrect alternative 1. Incorrect alternative 2. Incorrect alternative 3. Question 68. What are the 2 general enteral feeding routes? Nasoenteric tubes and ostomies. Incorrect alternative 1. Incorrect alternative 2. Incorrect alternative 3. Question 69. In this enteral feeding method, the formula is administered at a continuous rate over a 12 to 24 hours period. Cyclic feeding, intermittent tube feeding, continuous infusion method, bolus feeding. Question 70. This enteral feeding delivery method is recommended for critically ill clients because of its association with smaller residual volumes and lower risk or aspiration and diarrhea. Intermittent tube feeding, bolus feeding, cyclic feeding, continuous infusion method. Question 71. When using the continuous infusion method of enteral feeding, residual volumes should be measured every ____________. 2 to 4 hours, 4 to 6 hours, 6 to 8 hours. Question 72. In the continuous infusion method of enteral feeding, the feeding tube should be flushed with water every _______HR. 1, 4 hours 8. Question 73. For this method in enteral feeding, Formula is administered at a continuous rate over an 8 to 12 hours time period, often during sleeping hours. Bolus feeding, cyclic feeding, continuous infusion, intermittent tube feeding. Question 74. This N delivery method is often used for non-critical clients, home tube feedings, and clients in rehab. It mostly resembles a normal pattern of nutrient intake. Intermittent tube feeding. Incorrect alternative 1. Incorrect alternative 2. Incorrect alternative 3. Question 75. This N feeding method administers a large volume of formula, 700 ml max, usual 250-500 ml, over a short period of time, usually in 15 to 30 minutes, for -6x daily. Bolus feeding, intermittent tube feeding, cyclic feeding, continuous infusion method. Question 76. Contraindication for bolus feedings in N. Tube placed into the jejunum or duodenum. Incorrect alternative 1. Incorrect alternative 2. Incorrect alternative 3. Question 77. What is the temperature of feeding solution when administering N feedings? Room temp. Incorrect alternative 1. Incorrect alternative 2. Incorrect alternative 3. Question 78. What are some gastrointestinal complications that can result from N feedings? GI complications: constipation, diarrhea, cramping, pain, abdominal distension, dumping syndrome, nausea, vomiting. Incorrect alternative 1. Incorrect alternative 2. Incorrect alternative 3. Question 79. What are some mechanical complications that can result from N feedings? Tube misplacement/dislodgement, aspiration, irritation and leakage at the insertion site, irritation of the nose/esophagus/mucosa, clogging of the feeding tube. Incorrect alternative 1. Incorrect alternative 2. Incorrect alternative 3. Question 80. What are some metabolic complications that can result from N feedings? Dehydration, hyperglycemia, electrolyte imbalances, fluid overload, refeeding syndrome, rapid weight gain. Incorrect alternative 1. Incorrect alternative 2. Incorrect alternative 3. Question 81. To avoid food poisoning in N, replace the feeding bag, administration tubing, and any equipment used to mix the formula ever_____HR. 24. Incorrect alternative 1. Incorrect alternative 2. Incorrect alternative 3. Question 82. To avoid food poisoning in N, fill generic bags with only _____HR worth of formula. 4. Incorrect alternative 1. Incorrect alternative 2. Incorrect alternative 3. Question 83. What does TPN stand for? Total parenteral nutrition. Incorrect alternative 1. Incorrect alternative 2. Incorrect alternative 3. Question 84. What does PPN stand for? Peripheral parenteral nutrition. Incorrect alternative 1. Incorrect alternative 2. Incorrect alternative 3. Question 85. What are 2 reasons parenteral nutrition would be used? 1. Client's GI tract is not functioning. Incorrect alternative 1. Incorrect alternative 2. Incorrect alternative 3. 2. Client cannot physically/psychologically consume sufficient nutrients orally/enterally. Question 86. A client's caloric needs are very high and anticipated duration of therapy is greater than 7 days. Which PN would be administered, TPN or PPN? TPN. Incorrect alternative 1. Incorrect alternative 2. Incorrect alternative 3. Question 87. TPN can only be administered in A__________________ central vein. Incorrect alternative 1. Incorrect alternative 2. Incorrect alternative 3. Question 88. TPN is used when the solution to be administered is __________, meaning it is composed of greater than 10% dextrose, isotonic, hypertonic, hypotonic. Question 89. Peripheral PN is administered into A__________, resulting in a limited nutritional value. Peripheral vein. Incorrect alternative 1. Incorrect alternative 2. Incorrect alternative 3. Question 90. A client requires short-term nutritional support with fewer calories per day. What PN should be administered, TPN or PPN? PPN. Incorrect alternative 1. Incorrect alternative 2. Incorrect alternative 3. Question 91. PN4 lipids are contraindicated for clients who are allergic to and soybean oil, eggs, safflower oil. Incorrect alternative 1. Incorrect alternative 2. Incorrect alternative 3. Question 92. PN4 lipids are contraindicated for clients who have these two diseases: hyperlipidemia, severe hepatic disease. Incorrect alternative 1. Incorrect alternative 2. Incorrect alternative 3. Question 93. PN protein solutions are available in concentrations of to %, 3.5% to 15%. Incorrect alternative 1. Incorrect alternative 2. Incorrect alternative 3. Question 94. What two medications can be added to PN solution by pharmacy services? Insulin and heparin. Incorrect alternative 1. Incorrect alternative 2. Incorrect alternative 3. Question 95. Why would insulin be added to a patient's PN solution? To reduce the potential of hyperglycemia. Incorrect alternative 1. Incorrect alternative 2. Incorrect alternative 3. Question 96. Why would heparin be added to a patient's PN solution? To prevent fibrin buildup on the catheter tip. Incorrect alternative 1. Incorrect alternative 2. Incorrect alternative 3. Question 97. What are 3 desired therapeutic outcomes of PN? Improved nutritional status. Incorrect alternative 1. Incorrect alternative 2. Incorrect alternative 3. Weight maintenance/gain positive nitrogen balance. Question 98. What is the expected reference range of albumin levels? 3.5 to 5.0 g/dl. Incorrect alternative 1. Incorrect alternative 2. Incorrect alternative 3. Question 99. What is the expected reference range of pre-albumin levels? 15 to 36 mg/dl. Incorrect alternative 1. Incorrect alternative 2. Incorrect alternative 3. Question 100. Change the PN tubing and bag every _________HR or per facility protocol. 24 hours. Incorrect alternative 1. Incorrect alternative 2. Incorrect alternative 3. Question 101. To avoid hypoglycemia, and 4 of dextrose to % in water is administered if the PN solution is unavailable. 10% to 20%. Incorrect alternative 1. Incorrect alternative 2. Incorrect alternative 3. Question 102. A nurse is developing a teaching plan for a client taking insulin. Which of the following foods should the client carry with him as a minor snack to help treat hypoglycemia? Crackers, almonds, white chocolate, Lifesaver. Question 103. A nurse is educating a pre-diabetic client about the Mediterranean diet. Which of the following statements indicates that the teaching was successful? On this diet, I can consume wine instead of beer with no limits. I can still eat pizza each day because of the cheese, meat, and vegetables for my toppings. With this diet, a 12 ounces steak is still a viable dinner option. This diet will likely minimize my waistline. Question 104. A client expresses an understanding of seasoning food when he states, select all that apply. The preferences for salty taste eventually will decrease. C. Reducing sodium intake will lower my blood pressure. Salt substitutes replace sodium with potassium or calcium. Reducing sodium intake will lower my blood pressure. I should always prepare food from scratch. Question 105. A client with diabetes mellitus states, I cannot eat big meals, I prefer to snack throughout the day. The nurse should carefully explain that regulated food intake is basic to controlling blood glucose levels. Salt and sugar restriction is the main concern. Small, frequent meals are better for digestion. Large meals can contribute to a weight problem. Question 106. The healthcare provider is teaching a client diagnosed with celiac disease about the disease process. Which of the following statements made by the client would indicate a correct understanding of the teaching? I'm glad that I can still eat bread made with rye flour. I have an allergy to the proteins that are found in wheat. My immune system reacts to gluten and damages my gut. The bacteria in my gut are not able to ferment the gluten. Question 107. Which of the following are likely to increase your chances of getting chronic kidney disease? Ethnicity, genetics, mental status, access to healthcare. Question 108. Which foods are included in a lacto-ovo-vegetarian diet? Eggs, milk, honey, plant food. Eggs, milk, plant food. Eggs, honey, plant food. Honey, plant food. Question 109. Which of the following are functions of the kidneys? Select all that apply. Secretion of renin. Secretion of aldosterone. Excretion of nitrogenous waste. Secretion of erythropoietin. Question 110. Which of the following is an appropriate lunch for a patient on a level 1 dysphagia diet? Pureed meatloaf, pureed broccoli, and chocolate pudding. PB&J sandwich on white bread, applesauce, cooked carrots, and tea with honey. Chicken salad, a fruit cup, and a thin chocolate milkshake. Tomato soup with a turkey sandwich, orange, and brownies without nuts. Question 111. A nurse is conducting teaching with a client regarding nutrition therapy for gastroparesis. Does the nurse know the teaching is successful when the client states that the following are ways to increase nutrition? Select 3 that apply. Lay down for 1 to 2 hours after eating. Chew foods thoroughly. Control blood glucose levels for all patients, not just those with diabetes. Consume fats and liquids if fat and solids is not tolerated. Question 112. When recommending a healthy after-school snack, the nurse should suggest which of the following? Select all that apply. Low-fat yogurt topped with fresh fruit. Peanut butter and jelly on white bread. Apple slices with cottage cheese. Air-popped popcorn. Question 113. The nurse knows that children who are overweight or obese are at risk for developing what comorbidities? Select all that apply. Type I diabetes, coronary artery disease, hypertension, chronic obstructive pulmonary disease, COPD. Question 114. 1. Darius has a son who is 30 and is curious if type 2 diabetes can affect him. What would be the most appropriate response? Diabetes runs in families. He can expect to have it when he is older. Diabetes runs in the family, but is a preventable disease with proper nutrition and exercise. Diabetes is not contagious, so he does not have to worry. He does not have to worry because he is young. Question 115. 2. Darius just came out of the nutrition class, which would show that he understood the nutrition class. Select all that apply. Select 2. I must limit sodium to 2,300 per day. I can never eat cake or drink Coke again because it contains too many carbohydrates. I do not have to watch my carbohydrates because I am taking insulin. I cannot drink any alcohol because it can react with my insulin. Question 116. 3. The nurse is educating a client with hypertension who is obese and pre-diabetic about foods with cardiometabolic benefits. The client lives alone and is not used to cooking. The nurse knows the client understands the teaching when he states which of the following. I will use stick margarine when cooking my vegetables on the stovetop. I will continue eating sausage with my breakfast sandwiches for extra protein. Eating fruits and vegetables will help improve my blood pressure. I should not eat nuts because they have large amounts of sodium. Question 117. 4. The physician has advised a client to lose 50 pounds due to the risk factors associated with his weight. The client does not want to give up his eating and drinking habits. He asks the nurse why it is so important for him to lose weight. The best response is, your current BMI is too high for your age, you need to lower it to a healthy level. Individuals who are overweight are at risk for cardiovascular disease and heart failure. If you continue to eat the way you do, you will put yourself at risk for stroke. Losing weight will help promote your overall health and decrease the risk for future health problems. Question 118. 7. A woman in her mid-40s decides to lose weight to improve blood pressure. She starts following a diet reducing sodium, incorporating fruits and vegetables, and eliminating all meat. She lost 30 pounds last month and feels more motivated than ever. She presents to the clinic for a wellness checkup and is found to be anemic. What is the best priority nursing intervention? Recommend iron pills to improve anemia. Praise the woman for meeting her weight loss goal. Ask the woman what she is eating at home and assess diet. Diagnose the woman with an eating disorder. Question 119. 8. An 18-year-old male presents to the hospital with severe pain later attributed to multiple large kidney stones. He is treated with surgery but needs to stay in a post-op recovery unit, and while he is there, he continues to request milk with every meal and every snack. The nurse should first allow him to have milk anytime because calcium is good for the healing process. Advise him to drink less milk to improve his recovery. Confront the dietitian and tell them to stop letting him have milk. Ignore the situation because this is the dietitian's job, not the nurse's. Question 120. An 80-year-old male is admitted to the ER after an episode of hyperglycemia. He has been stabilized. His daughter comes to visit him and scolds him for not taking his insulin. What is the priority intervention for the nurse? Instruct the man on how to take insulin properly and send him home. Ask him why he did not take his insulin. Refer him to an assisted living facility. Scold him along with his daughter. Question 121. A local nursing home receives a new admission this morning. She has been diagnosed with gastroparesis. The dietitian is unavailable this morning and you, an experienced RN, are instructed to plan meals for her. Which of the following eating patterns is most appropriate? 3 large, well-rounded meals per day. 4 high-fat, high-protein meals per day. Multiple small meals per day. Tube feedings.